I muted myself. I wanted to say that our next presenter is going to be Tanja, and she heads iDefine Europe, and she's going to be talking about how we can leverage all of this data that's out there for that families have provided, particularly in the resource Genida, but in other resources, to get a better sense of KS. So, Tanja, I will let you further
Hi.
introduce yourself and take it away. Do you want to share your
Yes.
slides? We'll make sure we've got that
Yes.
working.
So first of all, do you hear me?
Yes, we
Probably,
hear you
yeah.
just fine. We hear you and
Yes.
we see you. Yes.
Okay, thanks. Okay, so I'm just going to share my slides. Okay. Okay. Presenter view. Okay, I
Oh,
think that
okay.
we are all
We
set.
see the notes,
Yeah?
Tanja. We see your notes version. If you can
Okay.
switch screens.
Just, yes, yes. Okay. Mhm. Swap. Okay.
Perfect.
Just a second. So now it should be okay.
Yeah, I see your slides.
Yes.
We
Okay.
should be good. Yeah.
Okay, thank you. Okay, so let's start. So first of all, to introduce me properly, so my name is Tanja Zdolsek Draksler. I'm a researcher at the Joseph Stefan Institute. I'm also the founder of iDefine Europe, the nonprofit. And most important, I'm also a parent to a child that was diagnosed with Kleefstra syndrome. And today I will be talking about different things, but they are all correlated, I would say. So I'm going to talk about the importance of us, parents, caregivers, the importance of data, and with focus on caregiver reported data, and also the importance of being really a global community in this rare disease landscape. Okay. So first, I just wanted to show you where I'm from. So I'm living with my family in a really small country in Slovenia, which is located in Central Europe. And I did put some pictures of Slovenia on the slide. And on the map, you can really see how small Slovenia is. And so that you will understand that my first thought when we got the diagnosis was actually that I need to connect internationally to be more informed and to also try to help making progress. So today we can really be proud because basically all of us did help that today Kleefstra syndrome is really a global community. So we are connected, we are collaborating, so we are truly internationally. And all of us have been working on this in the past years, and it really needs to be highlighted all the time and over again. Because actually being a global community, it also means that we are also collecting data globally, and that's very important in rare diseases. So here on this slide, I really try to summarize and put down all of the Kleefstra syndrome organizations and also Kleefstra syndrome active communities out there. So basically, we are on all of the continents and starting off with America, with North America, we have iDefine, of course, and also the community in Canada. Then in South America, we have Kleefstra syndrome Brazil and the community in Colombia. Very important that we have also representatives in Asia in Kleefstra syndrome Japan, and then there is the Kleefstra syndrome community in Australia. And then I did make a few more bullets for Europe because here we have again, several organizations and communities. And the oldest one and having the biggest communities are Kleefstra syndrome France, Kleefstra syndrome Italy, Kleefstra syndrome UK. Then we have the wonderful Kleefstra syndrome Spain, Kleefstra syndrome Slovenia with Croatia and Serbia, Kleefstra syndrome Netherlands, then the German-speaking community, Hungary, Poland, Turkey, and then these smaller points of Kleefstra syndrome representatives in Greece, Romania, Czech Republic, and Norway. So we really need to be proud of these achievements. So, in speaking about the global community, it's also great importance to know where the Kleefstra syndrome individuals are based. So this was, I think, highlighted already on the first day of the conference, but it is truly important to speak about this again. So this map is not only important to connect families that live very near, but also to get to know the number of prevalence of Kleefstra syndrome, and also to inform families maybe in the future for some specific countries or regions about some possible new research possibilities in which they might get enrolled in. So this map is really, really useful. And now we are going to move on the data. So in rare diseases, having these small numbers of patients per hospital, per city, per country, we can really not perform this usual clinical data collection and research, so as with common diseases. So here, we parents are the most important brick in this puzzle. So I put down in this table the active Kleefstra syndrome data collection activities. So in this talk, I'm going to talk mostly about Geneida, but I just wanted to make an overview so that all of you, but especially parents, are all informed where you can contribute very useful data about your children. So Geneida, RareX, Simon Searchlight, they are all collecting caregiver reported data. So they are differently designed, but the main focus is the same. And I also put down some anticipated numbers of how many Kleefstra syndrome parents are already involved in these activities. So except of Geneida, all the others are based or managed from entities from the US. There's also a link and logos to get familiar with it. And maybe also to mention, but I think it was already presented yesterday, so the Citizen Health, which is the only one which collects electronic health records. So regarding Geneida, today it has 222 Kleefstra syndrome individuals involved. And here on this slide, you can also see the distribution of participants by country and also by age. And you can see that, of course, the US caregivers are also already heavily involved in these activities. So why presenting this Geneida data? So also me as a parent, I'm also contributing information to this database. So we have been contributing data for several years. And this data is also studied. So that's the main message that we want to give you. So in the last 2 years, we have been conducting a study on this Geneida data, and today I'm going to present you the results. And these results mainly contributed like in 3 ways. So first, we got a deeper understanding about this Kleefstra syndrome phenotype. We published a scientific paper which maybe doesn't seem so important to you parents, but it's really very important. So not only to transfer knowledge, but also that Kleefstra syndrome gains on importance and visibility. And here you have a screen capture of this scientific paper. It was published in the European Journal of Medical Genetics in December last year. And I also added a QR code which you can easily scan to get to the paper. And one important point is also that this GENIDA study results were also the basis for starting the process about the Kleefstra syndrome clinical guidelines, so to conducting these recommendations. Which was also presented at this conference from Professor Titske Kleefstra, and she already said that this is now in the final phase, so this will be published soon. And also a lay version will be prepared in different languages so that it could be then disseminated through the Kleefstra syndrome community, and so from parents to specific doctors, pediatricians, and so on. So regarding the study that we conducted, so the GENIDA study is basically a caregiver-reported study on Kleefstra syndrome, and it provides a comprehensive analysis of the prevalence and severity of symptoms. And we use the data from 2016 till 2022. Which comprises a cohort of 172 individuals from basically all continents and from different countries, which are stated here on this slide, if you are maybe interested more in detail. And this Kleefstra syndrome cohort ranges from newborn to 45 years old. And also the gender was almost equally distributed. And the study is the most extensive caregiver-reported study to date on Kleefstra syndrome. So regarding the methodology, we have altogether, we have been studying 25 different groups of clinical symptoms. And as a final result, 20 out of these 25 were frequently observed and reported in Kleefstra syndrome. And here I put down the top 10 most frequently reported clinical symptoms, which are basically not a surprise for us parents. The top, on the top we have, of course, the behavior problems, and very high are also the vision problems and problems during newborn period. And I will present this a little bit more in detail in the next slides. So here you can see a table representing basically all of these 25 groups of clinical symptoms. And so as I already said, the majority of these clinical symptoms, groups of clinical symptoms, so 20 out of 25 were frequently reported in Kleefstra syndrome, with the prevalence ranging from high 67% to 25. So only 5 out of these stated groups of clinical symptoms were not so relevant, we could say. And you can see them on the top, not highlighted. Then this table also shows the answers from caregivers to really make representations to you. So the yes, no, and I don't know, which are also very important answers. And they are presented as a bar chart. And then on the right column, you have then the sample size, because there were different number of the sample size for specific clinical groups. And at the end, If there was applicable, we also analyze the severity, and this is presented on a scale of 3 stages, so namely mild, moderate, and major. While 2 groups of clinical symptoms, so intellectual disability and hearing problems, use a different scale, so a 4 stages in reporting, so mild, moderate, severe, and profound. And basically, this table already summarizing all of the groups of clinical symptoms is already very, very useful if you are a parent and if you did receive the diagnosis recently and are talking with clinicians, with different clinical experts who are not so familiar with this syndrome, so that they get somehow of an overview what is really needed to be observed and pay attention to. So in the next slides, I'm going to present the top problems a little bit more in detail to you. So based on this study, so the top rated problem were behavior problems, and this highlighted in high 67% of the reported data. And for these specific behavior problems that are showed here on this slide, there's also the severity and prevalence. And the top 5 behavior problems are repetitive behavior with high 54.5%. That ranges somehow from mild, moderate to major. Then we have attention deficit, 52.5% of prevalence. That's mostly moderate and major. The third one is anxiety, 46%. That's usually reported to be moderate. Impulsivity and restricted interest, both with high prevalence of 45%. So here we really need to be careful because, as I said, we included the Kleefstra syndrome cohort from newborns to 45 years old. So and the mean age of individuals in this study is almost 13 years. So we need to be cautious, as the number for all of these behavior problems can increase with puberty and with aging, so with adult population. So the next observed and frequent problem are vision problems. They scored high, 67%, and the most frequently observed problems are farsightedness and strabismus. And the next one are problems during newborn period, again high 66.5%. And looking for specifics, here feeding difficulties are reported, which are very high, almost 44% of prevalence. Then muscle weakness or hypotonia at birth, again very high, almost 38%. And jaundice, almost 30%, and signs of anoxia, so lack of oxygen, with almost 20% of prevalence. And the treatments that were performed during the newborn period, so the first 4 weeks of life, these were tube feeding with very, very high 58%, and assisted ventilation, again very high, 42%. And here we also have to mention that there were also other things, but they were not so reported in detail. So this would need further investigation and more data, basically, to dig in a little bit. What was this other? So moving on, another reported problem were walking problems with high 65.6%. And the most frequently reported problem was basically unstable walk with almost 32%. And the next one is diagnosis of intellectual disability. So here we need to point out that that's not the observation, but this of intellectual disability from parents, but basically the diagnosis from an expert, from a clinical expert. And here we got very high numbers, high prevalence. So almost 65% of the Kleefstra syndrome cohort has a diagnosis of intellectual disability. Here we have to be a little bit careful because we also have babies included and little children whom probably don't have this diagnosis yet, but we also have a high, almost 20% of prevalence for the ones that don't know yet. And regarding the distribution of this intellectual disability, we have a very high number of those having moderate and severe intellectual disability. Moderate is 30% and severe almost 50%. But some also reported profound intellectual disability, and on the other side, also mild intellectual disability was reported. The next one, the next group of clinical symptoms are problems during pregnancy and labor and delivery. So here we have a high percentage, high prevalence of almost 67%. And which are the ones? So these are cesarean section, excessive amniotic fluid, and also several others, but with lower representation. The next one is musculoskeletal problems. In general, as a group, scoring again high, 57%. But then looking at specific problems, the most reported are joint laxity, so looseness, and flat feet. And I also included here with the color scoliosis, because again, scoliosis and other orthopedic problems usually arise a little bit later in life, and maybe or probably this number would be also higher if we would be focusing on a little bit older cohort, so not also babies and little children. Another group of problems are digestive problems, and they also range very high, 57%. But when reporting, these are frequently reported constipation, almost 30%, and regurgitation, and repeated vomiting episodes with 14%. Another problem are feeding problems with high 52%. And when asking the parents a little bit more in depth, which are these feeding problems, they reported that their children eat too much or that they are craving for food. Then we have sleeping disorders. So half of our Kleefstra syndrome cohort is experiencing sleeping disorders. And regarding the seriousness of these problems, they are evaluated mostly as major and moderate, which is quite concerning. Here I have again the list of all of these groups of clinical symptoms listed, and so the most important one, the top 10, are also highlighted with color. So here I put again the QR code. So I really invite you to scan the code to see the paper, because basically everything that was presented in this presentation is also available in this paper. And so you can see it by yourself, and also use this paper, as already said, with your clinicians and with your community. And I would like to finish off with basically saying that one important note that we got also out of this study design study on Janida is that the prevalence numbers that resulted from this study are very similar, or in some cases also identical to the clinical results that were compiled in previous clinical studies, but on smaller cohorts. So this is in a way also some kind of confirmation for us parents that we really are good in reporting the clinical signs, the symptoms of our children, and that this caregiver reported data are basically really highly reliable source. And with this, I'm going to finish my presentation. Thank you for listening, and if you have any question, please.
Thanks, Tanya. I think it's really, yeah, it's really valuable to see these results, and it also really dovetails nicely with the presentation that Yael just gave earlier about kind of how they were, when they were going to a trial, they were looking at these kinds of family-reported data as what shows up as the key challenges, and then they were choosing from that. That's what we're going to focus on for our exploratory endpoints, and so it all kind of fits together. And I think what really helps with these kinds of studies is that it makes these things standardized, because it's so easy for us to kind of wave our hands and say, well, I know what KS is like. I have a kid with KS and I can tell you, but if until you get it into a really rigid format where it's in tables and we have numbers
Yes.
attached, you can't, no one, the FDA, places like the FDA and the EMA won't accept hand waving. They need clear data and information that's been standardized. And so it's really valuable. I was wondering, when you were doing all this data crunching from the raw United data, what were some of the biggest challenges you felt like you ran into? Kind of like,
Yeah,
like,
so
because it's a
so
lot,
basically
it's a lot.
basically there were a lot of challenges already getting the data in not really as a database, but on like single PDFs from each participant. So of course, with no personal information, but still, so it really took a while to just yeah, to really started working on the analytics, because we had a lot of pre-work to really start it. Yeah, so yeah.
Yeah, that was the
Yeah.
hardest thing, was just yeah. So there it goes to the value of having the underlying structure of the data databases be as good as
Yeah.
it can be. Yeah. Um, so yeah, it sounds like you guys did a
Yeah.
lot of work just cleaning it up, which is really important, of course, too.
Yeah.
The question I had, and maybe this is for the next wave of this kind of analysis, is how do we start to get a sense of what in our community stands out from the background of just neurotypical kids? Like, for example, I don't know what percent of neurotypical kids or just overeaters are always wanting to eat more, right? And so we know some kids with KS get overweight, but not all of them. And I'm not sure how unusual is it to eat too much. Like, it could be a lot of neurotypical kids are eating too much too. And so how do we get a sense of kind of the background, against what's being reported from parents with kids with KS versus what you
Yeah,
might
but
expect
yeah,
anyway.
yeah,
Yeah, yeah,
yeah, but yeah, again, so for each specific symptom, if we really would like to dig into, I think that we would need again collect new data. So
yeah,
that's the only way. And regarding this craving for food, it's too much. Yeah, I think that all of us did already experience this, but. I don't know. I think that this is my personal experience, not the data talking, but that probably it's also the case that they don't exercise so much. They have hypotonia and other problems and
yeah,
difficulties. So at the end, yeah, they are not lazy, but basically they can not be so active as the peers. So, but I also see for my other children, they are all eating a lot. So I think this is probably
yeah,
for all children. So not only for KS. Yes, and
yeah,
maybe I can finish off with something that we already talked, Eric, before, that probably the next task on our to-do list is to basically get all the data that's out there. So not only from Genida, but also from RareX and also from Citizen Health and I don't know, whatever is there, and to maybe combine this data together to make additional analysis, additional studies to really focus our attention to this effort, because I think that it's really important for the future to do so.
yeah. I agree, and I think a lot of these data sources are complementary, and yeah, I think there's going to be value in looking across them. So it's going to continue to be a huge project and task for our community going forward to try to put all this together and make the most of what everybody's contributed. So,
Exactly. But in the meantime,
yeah,
so the parents still needs to contribute. So that's the main
yes.
message. Yeah.
That is the main
Yeah.
message, is that all these contributions that take so much work really matter. And we have to collect the data first, and then we can start working on it. And we can't work on it until we have it. So yes, again, please, everyone who's in the community, have faith, do the work, get the data in, and then people will work on it.
Yeah.
Um, so there was a question from Jeff. He asked about, can you just speak a little to the security measures involved in in data collection? We hear from time to time concerns from the community about this, and we truly need participation community-wide. Can you talk a little about how the security works in Genida and
Yeah. So
anonymization, all of that,
yeah. So I know
or
for
other things
yeah.
for that matter? Go ahead. Yeah.
Yeah, so basically, I think that all of the stated collection systems, or how to call it, activities, registries, they all have incorporated privacy. So I know for sure that for Genida, they are also GDPR compliant. And I'm almost sure that also RareX is again GDPR compliant. So I know from this European perspective, for us GDPR is very, very important, and I think that this is already yes in the house. So I know that some parents are sometimes asking me, but not specifically for these data collection activities, but more they were asking me for the Kleefstra syndrome worldwide map. They had some concerns, but basically also for the map, I was always telling them that please just sign up. You don't need to put down your specific address. Just put in maybe the biggest city that the nearest city to you, and you can also tick off that you don't want that your child that the name of your child is displayed. So I think that for example for the map this is already enough, so that the privacy is there. And basically I think that only iDefine has the this data
Mhm.
and nobody can see it basically. So it's not being shared. And I know for sure for Janida, they are privacy compliant and very, very strict. This is also the case that they don't collect genetic information, which is not a good thing in looking from the data perspective. But so yeah, they decided that because of their strict ethical committee in France. And I don't know, maybe they will change this in the future. It would be good. But so that you know that they are all the time dealing with privacy. So and how to not cross the line here. So I think that we personally are, I don't know, with using maybe Facebook and other other
Yeah,
applications, maybe we would need to be more careful there and not
yeah,
in these data collection efforts that were mentioned here because uh, basically behind all of these data collection systems are strict rules and I think also strict committees, for example, ethical committees. So I don't think that these are like not carefully designed platforms. So I think that they are.
yeah. And for all those platforms, Rare X, Citizen, et cetera, they always will provide that information. They always have statements on privacy protection. So for those who are not sure about participating, you can always read that documentation, and they'll explain to you what they're doing to
Yeah.
protect your information. Yeah.